pectoral girdle, which is your shoulder, upper limbs, upper and lower arms, pelvic girdle, which is your hip bones, and then the lower limbs, your legs. Okay? That's your appendicular skeleton in a nutshell. And let's go with the pectoral girdle. You have a scapula and you have your clavicle, and they combine together to make the joint. Allows you to spin your shoulders around. Okay, this is the manubrium of the sternum. Remember the top part of our sternum. Okay, so this is the sternoclavicular joint, where the scapula, where the clavicle and the sternum meet. Okay, this is also called the collarbone, your clavicle. Okay. Pectoral girdle, your shoulder, consists of the clavicle and the scapula. That's what makes up your shoulder bones. Okay. The upper limb consists of the humerus, the radius, the ulna, carpals, metacarpals, and phalanges. And here's a picture of it. You see the diagram and the x-ray. This is your scapula. And this here is your clavicle right here on the x-ray. And this is your collarbone. That's your collarbone. That makes up your shoulder joint right here, these two bones. Okay, you got your humerus, which is the upper arm, and you have two bones of the lower arm, the radius and the ulna. Now remember the anatomical position. Anatomical position is with your arm flat at your side with your thumb extended to the outside. There's your thumb. So the bone on the same side as your thumb is the radius. That's the lateral bone. The bone medial is the ulna. So you got to remember your anatomical position. When you're in your anatomical position and you have your thumb, the same side as your thumb is the radius. The medial side is the ulna. The carpal bones make up your wrist. The metacarpal bones make up the back of your hand, 1 through 5. And the phalanges make up your fingers. Okay. So the clavicle connects to the scapula to the manubrium. Okay. It extends from the manubrium of the sternum laterally to the acromion process of the scapula. The collarbone or the clavicle is an S-shaped bone. Okay. It has a sternal end where it connects to the manubrium of the sternum, has an acromial end where it connects to the acromial process of the scapula, has a conoid tubercle and a costal tuberosity. It allows different types of motion. Retraction is taking your shoulders and pulling them backwards. Protraction is taking your shoulders, moving them forward. Okay? Elevation, taking your shoulders, moving them up. Depression, taking your shoulders, moving them down. Those are 4 of the movements you have at the shoulder joint. Okay. Again, so here's your humerus. This is the upper arm. This is the radius. Where's our radius? Right here. Actually, this is just the, head of the radius. This is your radius right here on this side. Okay, and this is the ulna bone here. So this is the thumb side, your outside portion. And this is your medial side right here. Okay, so the olecranon fossa, you have where the ulna connects to the humerus. You have the olecranon of the humerus, is this bone section here where it connects. And you have the head of the radius, and you have your ulna. The humerus has structures at the proximal end and the distal end. The proximal end is where it attaches to the shoulder, to the scapula. The distal end is where the humerus attaches to the radius and the ulna. At the proximal end, you have the head, greater tubercle, lesser tubercle, anatomical neck, intertubercle sulcus, and the deltoid tuberosity. At the distal structure, you have the capitulum, the trochlea, the lateral epicondyle, medial epicondyle, the coronoid fossa, and the olecranon fossa. Okay? And that's where they're at. Okay. This is the proximal end here, and this is the distal end down here. This is where you connect to the radius and the ulna. And you can see the different portions. You can see the anatomical neck, the head, the lesser tubercle, and the greater tubercle. Okay, at the bottom, you see the capitulum, the trochlea, condyle, medial and lateral epicondyles, and the coronoid fosses. Perfect. All right, the radius and the ulnas. Okay, the radius and the ulna have different structures at the proximal end and the distal end also. Okay, the radius is always lateral to the ulna. The ulna is the medial bone. Radius is on the thumb side. Okay, the proximal structures where it meets the humerus are the head, radial tuberosity, and the neck. The distal structures where it meets the carpal bones, okay, are the radial styloid process and the ulnar notch. So the head of the radius pivots on the capitulum of the humerus. That's how motion occurs. Okay. The ulna is medial to the radius, and the ulna has proximal structures: the olecranon, the trochlear notch, radial notch, coronoid process, and the ulnar tuberosity. The distal structures of the ulna is the ulnar styloid process and the head. So the trochlear notch pivots on the trochlea of the humerus for the ulna. The head of the radius pivots in the radial notch of the ulna. So you have a motion that can go back and forth and then pivot across the two bones also. Now the rotation of the ulna and radius are limited because you have an interosseous membrane here. So connecting these two bones, they can't move completely independent. It can give and spin a little bit and get some flex between them, but this interosseous membrane between the radius and the ulna hold them together and disallow independent motion between the two. Okay. And that gives you the different areas of each one. You can see the radius bone, okay, on the outside here. And this is the ulna bone on the inside here. You have the neck of the radius bone, head of the radius. Okay. You have the olecranon where it connects. And at the other end, you have the ulnar notch of the radius, the head of the ulna, and the ulnar styloid process. And you have the other end, you have the radial styloid process. Okay. And then on the other end here, you have the ulnar notch of the radius, the head of the ulna, and the ulnar styloid process, just like on the other angle of it, looking at the back. Okay, then you got the wrist in your hand. The wrist is your carpal bones. There's 8 bones that make up your wrist. There's 5 metacarpal bones that make up the back of your hand. And there's phalanges, which makes up your fingers. And the pollex. Pollex has 2 phalanges. All the other digits have 3 phalanges. The pollex is your thumb. That's Latin for thumb. So when you see the word pollex, and the muscle can be named that way too. Pollex means thumb. And the pollex has 2 phalanges. All the other digits have 3. Okay, so here's your radius and your ulna coming down. And these are the bones that make up your wrist. Those are the carpal bones. Okay, the bones that make up your hand are 1 through 5. These are your metacarpal bones. Okay, then all the other digits made up of phalanges. There's 3 phalanges, a proximal, a middle, and a distal in all of your fingers except for the phalanx. The phalanx is your thumb, and that only has 2. It has a proximal and a distal phalange. It does not have a middle phalanges for the thumb. Okay. Pelvic bone. Pelvic bones is your hip bone. It has 3 coccyx bones, the ilium, the pubis, and the ischium. Okay, the lower limb consists of your femur, your patella, your tibia, your fibula, tarsal bones, metatarsal bones, the hallux, and the other digits. Hallux is your big toe. Okay, so the hallux is your thumb, hallux is your big toe. Okay, each of those is going to have 2 bones making it up, 2 digits. The other one's going to have 3, correct. Okay. So here's your pelvic bone, your hip bone, and here's your femur. Here's the patella. What's the main purpose of the patella is to protect the knee joint. your tibia, which is in the front. So when you kick your shin into something when you're walking at night and you hit your bed frame or something, you're hitting your tibia. And the fibula is the one in the back. You have 7 tarsal bones that make up your ankle. You have 5 metatarsal bones that make up the top of your foot. And then you have phalanges that make up the digits. Okay, so pelvic girdle, your hip bone, supports and protects the lower viscera and developing fetus in females. The bones of the pelvic girdle and lower limb are much more massive than the homologs or the same similar ones of the upper limb. Why would that be? Why are the leg bones so much thicker and longer and bigger than the bones of the upper part of the body, the upper arms?
Support your weight.
Support your weight. All of your weight, everything, your mass of your entire body is supported by your legs. Those muscles, those bones are going to be huge compared to everything else. There's 2 pelvic spaces, a pelvic inlet and a pelvic outlet. The pelvic inlet is the superior space between the brim of each coxal bone. The pelvic outlet is the inferior space between the ischial spine of each coxal bone. So your pelvic inlet is your superior space. Your pelvic outlet is your inferior space. Okay. Again, here's your pelvic inlet right here. This is where it comes in. And this is your pelvic outlet right here between the 2 points, between the ischial spines. Okay. The male and female pelvis are different because of childbirth. The main anatomical difference is regard to childbearing. You have the pelvic outlet, which is larger in females than in males. You have the sacrum curve, which has less curve in females. Okay. The pelvic inlet is wider in females. The pubic angle, greater than 100, is a female, less than 90 is male. Okay. We're gonna go over a lot of different between male and female skeletons. It's really not true. If you find a skeleton, you can make a guess at whether it's male or female, bigger bones, smaller bones, more brittle bones, more rugged bones, wider here, wider there. The only thing that you can use to identify a male versus female, if you find a skeleton, that's almost guaranteed, is this pelvic angle right here. Pubic angle, I'm sorry. Okay, if you have a pubic angle and it measures greater than 100 degrees, it's a female. If you find a bone and you want to identify it, it's a female. All these CSI shows that say they find his hand bone, oh, it's a male. Yeah, it doesn't work like that. Or they find a tooth, oh, that's a male. No, it doesn't work like that. You can make a guess, but it doesn't work. The pubic angle, if you've got a skeleton with it, you can find the pubic angle, I can tell if it's male or female. You can say male or female. Greater than 100, it's going to be female. Less than 90, it's going to be male. That's the biggest thing we got that actually tells the difference. And you can see it right here. Here's your angle. This is the pubic angle right here. If this angle is greater than 100, that is female. If this angle, same angle, is less than 90, that's male. That's how you can tell. If you find a skeleton in the desert, drug deal, whatever we find skeletons out there all the time, okay? If you want to identify male and female, you can look at all the arms, you can look at the teeth, you can look at the size of the skull, you can look at the roughness of the bones. All that really doesn't matter because there's so much variation. This is the only thing that it doesn't vary. If it's less than 90, it's a male. If it's greater than 100, it's a female. That's how you can identify all your CSI shows, not all the other stuff. Patella. Patella is a large sesamoid bone. A sesamoid bone means it does not articulate with other bones. Sesamoid means it's embedded within a tendon or within a muscle. It's a bone that does not articulate with other bones. That's your patella. It's within a tendon in front of the kneecap. Its sole purpose is to protect the knee joint. That's what it does. Okay. Its anterior surface is rough, so the tendon can attach to it. The posterior surface is concave facet, so it can move and glide as the knee bends. Okay. You can see the rough anterior surface. This is the base, this is the attachment. This is the rough surface here where the tendon attaches. Okay. This is the base of the patella, and this is the apex. All right, your ankle. Your ankle is made up of tarsal bones. Remember, the wrist was made up of carpal bones. Okay, there are 8 of them. The ankle is made up of tarsal bones. There's 7 of them. Okay, metatarsal bones make up the arch of the foot. Phalanges, the hallux has 2 phalanges. All the other digits have 3 phalanges. Hallux means what?
Big toe.
Big toe. Hallux means thumb. Hallux means big toe. Okay, the hallux had two phalanges. The hallux has 2 phalanges. So the thumb and the big toe each have 2 phalanges. All the other digits, your fingers and toes, all have 3 phalanges, the proximal, middle, and the distal. So these are the 7 bones, 7 tarsal bones that make up the top of the foot, the arch.
There's a question in the chat.
How does the female pelvis change during pregnancy? The female pelvis, thanks. The female pelvis it allows it to expand during pregnancy. In other words, I can go back real quick here. Okay, this portion, see right here, this is your pubic symphysis. This, I'm drawing on my computer screen. It doesn't work. I got to draw my pad. All right, this is your pubic symphysis right here. This is cartilage. As the baby comes down the birth canal, this allows this to expand and open up. Okay, when it comes back, it still comes back. The angle here is always going to be greater than 100 degrees. But once this expands, that allows the baby to come down the birth canal. So that's how the pelvis changes. The angle, even if you don't give birth yet, is still going to be greater than 100. After multiple pregnancies, this cartilage becomes stretched out. Okay, and the angle becomes greater. It never becomes less. So anytime you take that angle, this angle right here, and if it's greater than 100 degrees, that's a female. If it's less than 90, that's a male. But this cartilage right here expands during pregnancy and allows those bones to separate so the baby can come down the birth canal. Did that answer the question?
Yeah, it did. Thank you.
Okay, perfect. No problem. Thanks. Yeah, if someone comes up in chat, just someone tell me, I'll look over there. Not a problem. Okay, so the tarsal bones, 7 tarsal bones that make up the ankle, are the calcaneus, the talus, navicular, cuboid, the medial, intermediate, and lateral cuneiform. Those are 7 bones of the ankle. Okay, and then the metatarsal bones. You have the tarsal bones up here. These are your tarsal bones, and these are your metatarsal bones. There's 5, just like in the hand. In the hand, they're carpal bones. In the foot, they're tarsal bones. Okay, these are the metatarsals, and then here's your phalanges. Each one has 3 digits. The proximal, middle, and distal, except for your big toe, the hallux, which has 2, proximal and distal. There's no intermediate, there's no middle phalanges for the hallux. Okay. Skeleton can reveal important information about an individual. Information such as race, medical history, body size, muscle mass, age, and sex. Yes and no. There's certain differences you can kind of guess on the race. Medical history, if someone had an artificial hip, yeah, you can see an artificial hip. Broken bones that have healed, yeah, you can see a history of broken bones. So some medical histories can do that. Body size, if the skeleton's big, the person was big. If the skeleton's small, the person was small. Okay, muscle mass tends to go along with it. Age is very hard to do, especially as you get into the older ages. It's easy to do with younger people because you can look at teeth, you can look at other aspects of it. And sex, if you have that pubic angle, you can determine sex. General appearance. Take these with a grain of salt. This is not, this is not what we use in the field for reality. This is TV show, this is academic. Reality, this doesn't hold up, okay? I mean, heavier, rougher surface, lighter, smoother surface. I've seen females that have some very large, heavy skeletons. I've seen males with some very small skeletons, very lightweight bones. You know, for a male has a more sloping forehead. Female has a more vertical forehead. Sometimes, you know, you ever seen a female with a sloping forehead or male with a vertical forehead? Yeah. Sinuses are larger males than females. Not really. If you go with the size of the skull. The cranium, they say males are 10% larger than a female's cranium. A male wrote that. You know, it's not going to hold up. Everybody's different, you know. There's no brain size or cranium size that you can say for the sexes. You can say some averages, but the only thing that really holds up is, like I said, that pubic angle. That holds up. Greater than 100, it is female. Less than 90, it's male.
Would questions like this be a
Mandible
nursing exam?
larger in males, lighter in females, smaller. What's that?
Would
was
questions
that?
like this be on a nursing exam?
I'm trying to think. The only one I've seen on the nursing exam was the pelvic angle. I haven't seen any of these other nursing exam. I mean, just think about it. I mean, here, teeth, larger teeth in male, smaller teeth in female. Have you ever seen a male with small teeth and a
Everybody.
female with large teeth? Yeah. I mean, that's not, it's all depending how they're built. Bone markings, bone weight, general appearances, pelvic inlet. Here we go. Angle, the inferior pubic symphysis. This one I agree with 100%. That's a given. The rest of it's just sort of. Just take it with a grain of salt. Maybe most males have different shapes than females, but it varies. I've seen so many autopsies and skeletons, and you can't do that. You can't look at a tooth and go, it's big, it had to come from a male. It doesn't work like that. But if you give me a pelvic bone, it's dead on. I can tell you if it's male or female. Age-related events, bony major, you can tell by mineral content. If you have a skeleton and it's got fontanelles in it, it's usually under 2 years old because the fontanelles haven't fused yet. Okay, there's different reduction in mineral content, but then again, that goes along with hormone changes. If the female's been pregnant a lot of times, they're going to have different calcium levels in their bones because of the pregnancy. So you have to give and take certain things when you're trying to do general ages on it. But this is good. The fontanelles are completely by age 2. So if you got open fontanelles on a skull, it's going to be less than 2 years old. That you can tell. You got fusion of the fontanelles, it's going to be between 2 to 8 years old. Fusion with the fusion ossification centers, 1 to 6. Fusion with the temporal bones, 12 to 6. That's just normal development as you can occur. Complete ossification, 25 or 30. Okay. Also, you do baby teeth has erupts and patterns. Start coming in at 9 months old. You the different incisors. Then the first year molars come in at 6 years old. The 12-year molars come in at 12 years old. Okay. Wisdom teeth come in around 18 or something like that. They're starting to ossify. So you can get a guess. But as you get older, 25 and up, it's going to be really hard to get an age on somebody. Wait a minute, there's one more I wanted to say. Here's another one that doesn't make a whole lot of sense. The mandible, loss of teeth, reduction of bone mass, change in angle of mandibular notch, accelerates in the later years, age 60. Okay. You should not be losing teeth at age 60. Okay. That's not a foregone conclusion. You can lose teeth at 20, 30, 40, 50, whatever. But it's not genetic disposition to lose teeth as you get older. If you take care of the teeth, you reduce periodontal disease, maintain your teeth, they're going to last the whole lifetime. That's what they're designed to do. They're not going to come out because you reach a certain age, as this implies. So I don't agree with that. I mean, I spent 30 years not agreeing with that with my patients. All right, general appearance, major curves. We talked about the curvature of the spine. 3 months to 10 years, you can see the different spines. The spine goes from straight, starts to bend, and you get more curvatures. Again, that's not in stone because you get different variations of that. Different fusion of the epiphyseal cartilage, the growth plates. Around age 21, 22, the growth plates start to close. And so some of these are good, just guesses. But the only one that's a really good guess or a really good fact is the pelvic angle. All right, who's paying attention? What's that pointing to? Top line.
Scapula. Clavicle.
A clavicle.
Clavicle, right there. That's your clavicle or collarbone. Okay. What's the next one pointing to?
Scapula.
Scalpel.
Scapula, between the two. Next one, what bone is that?
Humerus.
Humerus. Okay, look at the next bone. Now be careful. Which bone, remember it's the anatomical position, which bone is on the distal side, the same side as the thumb?
Radius.
Radius.
Radius. Perfect. So the other one is the
Ulna.
Ulna.
ulna. What connects the radius and the ulna between them? What's that called?
Metacarpal bone.
No, not a
That's all.
bone. It's a membrane.
Full bones.
Carpal tunnel.
Oh, intramembranous.
Got it. Perfect. The intramembrane. Now I forgot the name of it. The intramembranous membrane connects them, right? Okay. Now, what are these bones connecting here? These are which bones?
Carpal bones.
Carpal bones. And how many are there?
Did you already see the question in the chat?
Oh no. Oh yeah, yeah. We already did that one.
Okay.
The pelvis changes because of the cartilaginous pad between there expands during pregnancy. It allows the birth canal to open up. The bones don't change, but the pubic symphysis, the cartilaginous pad expands when the baby puts pressure on it, allows that canal to open up. Does that make sense?
Yes, thank you.
Okay. Oh, no problem. No problem at all. Okay, so how many carpal bones are there?
8.
8.
8 carpal bones. Perfect. And these bones are what? Make it the top of the hand.
Metacarpal.
Carpals.
Metacarpal bones. How many are there? 1 to 5 rates, that's how many there are. And the next ones are
Phalange.
Phalanges.
phalanges. How many bones are in each phalange?
2 in the pollex and 3 in the rest.
Perfect. Perfect. You got it. All right. Top bone here.
Pelvis.
Pelvis or hip bone. Either one is perfect. What's the next bone coming down? Largest bone in the human body.
Femur.
Femur. What's the next one?
Patella.
Patella. That's your kneecap. What's the next? What's the one in front of the leg that you hit if you hit your shin?
Tibia.
Tibia.
The tibia, right? And what's bone behind it?
Tibia.
Tibia. And what bones make up the ankle?
Tarsal
Tarsal
bone.
bones.
Tarsal bones, right? And how many tarsal bones are there?
Same 8.
No. Ankle and the wrist are different.
7.
7. There's 7 tarsal bones that make up the ankle. Okay, what's under, and these bones are what? Make up the arch of the foot.
Metacarpal.
Metatarsal bones. And the other ones are
Phalanges.
phalanges. And there's 3 phalanges in every digit except for the
Hallux.
hallux. Only has 2.